or TIPS Masterclass webinar, What Are You Bringing Home? COVID-19, Evidence and Guidance for Frontline Workers to Protect Family Members from COVID-19 and Other Pathogens. The highly transmittable nature of this novel virus and the exposure risk associated with it are evolving daily. Understanding the most recent updates on government and regional, on COVID-19 rather, is essential, and we implement recommended processes and procedures from government and regional healthcare authorities. These recommendations will provide maximum efficacy against the virus while maintaining a safe environment for our staff, patients, and customers. The learning objectives for today are posted on the screen for your convenience. Participant lines have been muted. Unfortunately, continuing education or CE credits are not available for this event due to the limited time to obtain approval in this evolving COVID-19 situation. We will be hosting another webinar Tuesday, April 21st at noon. The webinar topic will be best practices to service facilities for COVID-19. My name is Dr. Katie Morales. I'm a professor of nursing at Berry College in Rome, Georgia. This presentation will last 50 minutes, followed by 10 minutes for questions and answers. Please type your questions in the webinar panel labeled Q&A. We will follow up after the webinar to address any questions we are not able to answer during the webinar. By participating in this webinar, you acknowledge that the statements and information provided is for general guidance purposes only. The coronavirus situation is evolving and dynamic. You are advised to contact your local government and regional health authorities for specific instruction on all the topics mentioned in this webinar. This webinar is not to replace the guidance and direction of your local government and health authority. The webinar series is hosted by the Infection Prevention Strategy, or TIPS. TIPS is a not-for-profit organization existing to advance innovation, ideas, and processes which make a difference in global health. TIPS extends to over 30 countries and is the key strategic partner for many notable organizations, initiatives, and events. In the past few years, TIPS has contributed millions of dollars worth of scientific impact through various programs. You can learn about their successes in several ways. On their open access journal, www.infectioncontrol.tips, at conferences such as the HITS conference, www.hitsconsortium.org, through their masterclass events, www.masterseries.events, or on their podcast series, www.deepdive.tips. This webinar is sponsored by Kersia Medical, manufacturers of the NADCC fast-dissolving effervescent tablets used for surface disinfection. These tablets are used across the US and globally in hospitals and other facilities. They release hypochlorous acid when dissolved in water and are EPA approved for sporicidal, for emerging pathogen viruses such as SARS-CoV-2 and biofilm. Without further delay, let me introduce today's speaker. Michael Gately is Managing Director of Medintech and is Vice President of Kersia, a global leader in hospital disinfection and industrial food hygiene. He holds a degree in social science from the University College of Dublin, an MBA from Smurfit University College of Dublin, and postgraduate studies from Harvard. Michael is qualified trainer in hospital infection control. He has been an associate lecturer in organizational behavior with the National College of Ireland and the Institute of Public Administration. Visiting 25 countries annually, he worked in over 100 countries on infection control issues and behavioral change training. Some of the major post-events Michael has worked include the Indonesian tsunami, SARS outbreak in Asia, earthquake and cholera outbreak in Haiti, and flooding in Pakistan and Vietnam. I'll turn this over to Michael.
Okay. Well, hello everybody, just letting the screen come up. Thank you all for dedicating your time today, and thank you Dr. Katie and the TIPS organization for your kind invitation. So friends, this talk arises from a global literature review of academic publications relating to the risks that are faced by you, the healthcare workers, in bringing pathogens home to your family. And frankly, the results, they really have shocked us. The talk itself, it deliberately focuses on what happens outside the hospital more so than what happens in the hospital, although inevitably I'll speak about some things within the hospital. And the body of work here addresses pathogens generally as well as coronavirus. So I'll start, as I start all my talks, with this comment from the Director General of the World Health Organization. And here's what she said. The emergence and spread of drug-resistant pathogens has accelerated. More and more essential medicines are failing. The therapeutic arsenal is shrinking. The speed at which these drugs are being lost far outpaces the development of replacement drugs. In fact, the R&D pipeline for new antimicrobials, that's antibiotics for Europeans and Asians, has practically run dry. So friends, all of you and all of us, we are the last line of defense. Disinfection is the last line of defense. Today, so we're going to talk about what's the problem and how big is this problem, who's at risk at home and why are they at risk, what's causing the transmissions, and we'll go through some guidance then. So let's start with what the problem is and how big this problem is. The frontline workers can be everybody. Obviously nurses, doctors, environmental services workers, but also the frontline grocery people. As the infection preventionist John Larissel recently said, it's an environment of shared risk, and we're all in this together. When we did this study, we got one enormous shock, and that was that significantly higher infections were observed amongst the family members of healthcare workers than the family members of patients. Now, take a moment for that to sink in. The people in the hospital with the diseases, their family members have less diseases than the family members of your family members. Came as quite a shock, and there was a number of different studies proving this. Our second biggest shock, of course, was globally there are very few studies which have relatively very few academic studies which have examined this issue of healthcare workers bringing pathogens home to their families. And even less, which is disappointing, even less studies were found on environmental services staff. For the Europeans and Asians listening, environmental staff are what we would call currently the cleaning type staff. Very few studies, and yet in one of the only ones we did manage to find, we found, of course, that these housekeeping staff had higher rates of tuberculosis, higher than other people within the healthcare system. So what we want to do today is to get you to ask yourself, what are you bringing home to your most vulnerable family members? What pathogens are you bringing them home? When are you most at risk to your vulnerable family members? So the risk that you pose to them can vary. How are you bringing these pathogens home? And then when are your family members more vulnerable? So 4 separate questions, and I hope to help you answer them before the end of this conversation today. So healthcare workers are dying from what they pick up in hospitals. If I take as a parallel example, 2,300 of our brave NYPD officers have tested positive for coronavirus, and they don't on a daily basis interact in quite the same way with people who already have coronavirus in intensive areas. So imagine if that's the level of infection amongst the officers, what it could be amongst our healthcare staff. You, healthcare worker, you can act as a reservoir for transmitting the infections to your families without being sick yourself. So you could be out jogging, you could be doing the things you normally do, feeling perfectly healthy, and yet you're bringing the diseases to your family members. And of course, these infections would hit immunocompromised people, and you might act as the reservoir. I remember well working during the SARS outbreak how 1 in 5 of the people affected were actually healthcare workers. Healthcare workers, especially those taking care of high-risk patients, pose a heightened risk of transmitting the pathogens. And again, another study by Liu et al., they showed that there were higher rates of nasal carriage of pathogens amongst healthcare workers' families than the families of patients. And then again, a different study, recent studies have identified how healthcare the household members are more likely to carry MRSA than the general population. So the facts are there, folks. The facts are stark. We have to protect our families. Here's an interesting case study by Allen et al. This nurse had recurring chest infections, MRSA, and she'd been given antibiotic treatment. the infection was also found at separate and different times amongst her son and her husband. And eventually the suspected mode of transmission were their toothbrushes, where they were touching each other. But MRSA was found amongst all the soft furnishings in the house, etc. So it's very difficult to get out of the home when it gets into the home. And it can ping pong back and forth. And this is where we want to break this chain of infection. This is an important slide, friends. It's a long list of, or it's a list of the family members who have heightened vulnerability. Elderly people to start with, and we all know what's happening right at this time. But even if we don't talk about coronavirus right now, we know that C. diff spores affect elderly people more so than the young, and particularly elderly females. So if you're looking after a C. diff risk patient, then you are more risky to your family, and if you have an elderly parent, they are more at risk. Babies, of course, particularly weaning babies, have less immunity and they're vulnerable. People who are ill or recovering from illness, they're more vulnerable. Taking antacid tablets, I'll talk about that in a moment. The next, I'm sure you'll all join me in saying, and we should say it together, please avoid taking antimicrobials, antibiotics. They're overprescribed, and it's something that we all want to encourage all our families to avoid. But they can reduce immunity. People with AIDS have more vulnerability. People undergoing treatments such as cancer or transplant. People on dialysis. Simple things like asthma. Or even more simple, people with open cuts in the home, simple acne, cold sores, blisters. These are all our family members who have a heightened vulnerability. So part of what you do needs to help protect them during these vulnerable periods. The elderly, as I mentioned, this study here found, not to our surprise, that the heightened level of respiratory illness amongst the elderly. But shockingly in this study, the authors identified 37 different pathogens associated with 206 outbreaks in the long-term care facility. But the big shock, of course, was that the healthcare workers were infected in more than 50% of these cases. Now, remember, in the long-term care facilities, you don't quite have the same level of infection risk, and yet here, half of the healthcare workers were infected and were likely to bring it back to their family. So it just evidences how we need to be so careful. The acid suppressants, plenty of well-known brands there, they can reduce your immunity. Simple thing like that. So less is more when it comes to taking any prescribed or unprescribed medicines. Obviously, children with any underlying conditions can be more vulnerable. Here, 28.6, almost a third of children with cerebral palsy will contract some form of respiratory tract infection when they're exposed to healthcare-associated infections. So, and obviously, during this corona crisis, we need to be particularly careful. If you have a child who needs care and needs to come to your bed in the night time, consider sleep. I know it sounds funny, but it actually works. Consider sleeping head to toe with them, and the same goes for your partner if they're at risk also. Pregnant ladies, the new infant showed that this study showed that neonatal infections in the first week of life is associated with maternal infections. So basically, the mother catching the particular pathogens affects the newborn. Okay. Let's start looking at what's causing the transmissions. And here's something we rarely talk about, but we should. Let's start with ourselves and the potential for clinical burnout. You're coming off a late shift, you're coming off a long week, you're tired. We can drop our guard. We just want to get home, and we can drop our guard in terms of our infection control procedures for ourselves. But we need to have heightened awareness these days. I really love the comment by Jordan Peterson when he talked about people. He said, look, you need to treat yourself like someone who you have responsibility to take care of. Every day in the hospital, you're almost genetically programmed to care for and help people, but you can forget about yourself in all of this. So be careful for yourself, and as he said, treat yourself like someone whom you have responsibility to take care of. And then that transfers on into educating your families, because when you're taking care of yourself, you can also then be a role model for your families. Okay, now before we get into what we're going to do at home, just a few tips for you that people have found important over the years. A couple of points. A moist hand, if you wash your hands well, but a moist hand and don't dry them properly, you pick up 7 times more germs than a dry hand. So not only is the proper procedure to wash your hands important, but also proper drying is important. Movable bed tables. All over the world, I see patients pulling the table by putting their hand underneath and thumb on top and pulling the table towards them. And yet I very, very rarely see the underneath of the table being disinfected. So in your role as infection preventionists, if you have a seat on the infection control committee, try and encourage that the training be given to disinfect under the table themselves. The next point also comes from quite a shocking study. In this study, it was found that 93%, this was Hu et al. And previously Professor Vickery, 93% of all intensive care units or surfaces have a biofilm growing on it. That's a biofilm on the operating tables, a biofilm throughout the entire area. And shockingly, 50% of them have multi-drug resistant organisms living in it. So again, for your seat on your infection control committee, you need to be using a EPA approved product approved to kill the biofilms, wet surface biofilms that live around any kind of sinks or showers, etc., etc. But we need to be addressing these biofilms. And then finally, as I've already mentioned there, higher risk patients, you need to take more care of yourself. So here's an admission. I've been doing these training programs for 18 years, and for 17 of those years, I've been saying to people, look, floors aren't so important, no big worry. And I was wrong. Recently, Professor Donsky did a study where he and his researchers took 1 square meter of the critical care area and inoculated it with a non-pathogenic indicator germ. 3 days later, that germ was found on every single surface in the ICU. And that was despite the unit having a good procedure and for disinfection. So imagine, only 1 square meter, not the whole floor, just 1 square meter turned up on every surface. Here now, in this study, direct from Wuhan, carried out by the military medicine, they found the virus was this is the coronavirus, was most heavily concentrated on the floors, probably caused by gravity in the droplets. And half of the samples of the soles of the shoes of medical staff tested positive for the virus. So, as I said, I was wrong. Floors are dangerous. Floors need to be disinfected, particularly during this crisis. And you need to use a proper disinfectant, so not a cleaner, not a detergent. So again, please try and influence your infection control committees. I want to give you just a quick insight into what I mean by driving defensively. For one particular study, I embedded myself in an intensive care unit, post-operative area, for 48 hours. Basically, for as long as I could stay awake in the chair, I sat and watched for this study. And there were the usual breaches of protocol caused by, tired people not being trained properly, and of course the usual. The more qualified people are, the less they seem to think they need to do the proper disinfection. But in this study, when the surgical staff had left their staff canteen, I went down for dinner. And I'll give you all one guess, and just one guess, as to where all the chairs were. And you've got it. Every single chair was up on the table so that the cleaning staff could clean the floor. Now, you all know that the next day, all of the medical teams that are in there will pick up whatever was on the floor on their hands and sleeves and so on. So my point is that when we're taught how to drive, we're taught to drive defensively. It means we watch out for people doing things to us. We watch out for cars coming out from places that they shouldn't and so on. The same goes for the hospital environment and how you protect your family. You have to assume the chairs are on the table. Therefore, you have to disinfect yourself properly when you're returning home. And here is the study that proves exactly what I observed. 31% of the uniforms tested positive for one or more pathogenic organisms. Here, a study, this is very sad actually. In this particular study, between 25 and 50% of physicians' coats were found to harbour Staphylococcus aureus, and even the neckties were seen. I'm reminded a very sad situation. I was doing a talk, I won't say the country, but I was doing a talk in a Central American country where I was on the slide similar to this and saying how we need to protect our family from the uniforms. And sitting in the audience was a physician who had recently been going home to breastfeed her infant son, and regrettably the son died, the little child died from something that picked up off her whites off her uniform. So our uniforms are contaminated, there's no doubt about it, so we need at this time and at all times to take greater care. And now with washing machines running lower temperature cycles, what you get is a germ stew in some of the sumps of these washing machines. We took apart the washing machine and we found biofilm growing on the back of the rotary drum. So we'll talk about a little later some things you can do to help mitigate that. You all know we were going to get there, folks. You all know we were going to talk about mobile phones or cell phones. So let's go through this. This study found that between 50 and 65% of healthcare workers use their phones during physical contact, put them down on the surfaces, etc., and that most people just don't regularly clean them. Half of all the phone samples that were sampled had some microbial growth in them. The majority of us knew, 90% of us never cleaned. So we know that there are potential pathogenic bacteria on them, but we're not cleaning them. Friends, we put these beside our face, we put them beside our mouth, we hold them with our hands. We have to now treat them like a danger zone. We love our phones, they're part of our body. They're our outlet for relaxation, perhaps at the end of a busy day. The minute we get out of the hospital, we're putting them up to our face again, but we have to treat them as a danger zone. Now, here, I'll just read you through this because I think it's going to be useful to you. Occupational hand dermatitis likely causes increased rates of nosocomial infection. So this is from the pathogens entering through the cracks in your hands and also from pathogens living there and being transferred to the home. So generally speaking, for Clostridium difficile, you should wash your hands in cool water with soap, not alcohol. You rinse your hands well before putting on gloves, as any of the soap residual can increase the irritation. And ideally, moisturize your hands after you've used the soap. Outside of that, you can use, obviously, alcohol for this COVID crisis, but ideally encourage your hospital to be using alcohols that don't have colours and don't have scents in them, because these can cause irritation. It's the residual on your hands that can cause irritations. Facial hair is a small issue. I don't want to suggest it's a huge issue, but if you have a beard, then consider a proper wash before going home, because they do harbour an increased amount of bacteria. Okay, so let's get into some of the guidance now, friends. Achieving behavioural change can be a difficult thing, and it needs to be done in a gentle way. So be gentle with yourself. Don't consider this a task. It's not an extra regime to impose on your family. You really need to consider it like part of the gentle process that eases into family life and becomes part of the loving process of the family. So, for example, if you've children, you can make a game of it that anytime somebody touches the T-zone, they lose a penny, and so on and so on. Or even with your partner or family members, they lose $1. However you want to play it, but make it something that's part of you all, rather than something you're trying to impose on them. And what should our homes be like? This is a spectrum. On the left-hand side is one extreme, on the right side is another extreme. Tropical entropy is where very often suffered by children, where the environment and the amount of pathogens that they're being challenged by and organic matter they're being challenged by on a daily basis means they can't even take in proper inoculation orally, because it just shoots straight through their body, so that they can't absorb nutrients properly, such as the level of dirt and the constant challenge to their system. On the right-hand side, there are many situations or studies of Japan where children don't acquire the correct immunity because their homes are not quite sterile, but so highly disinfected. My point is that as a healthcare worker, you shouldn't be in the middle of this spectrum, but you should certainly be to the right of the middle line. And depending on your risk level and your daily variety in the risk that you're undergoing in work, you can consider increasing the disinfection in your home. But please, 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 everybody, have your vaccinations up to date. And don't forget the boosters. And the same goes for your family members. Okay? Now, this is just a simple little algorithm for you to consider for elderly people in the home or other immunocompromised people. If possible, how can you separate yourself from them in the home? If you can, great, stay separate in the home. If you can't separate yourself during this crisis period, then can they stay elsewhere or can you stay elsewhere? All around the world, folks, all around the world, I find that it's the healthcare member of the siblings that ends up looking after mom or looking after dad. But in this occasion, now is the time to plea that they shouldn't be in your home. So where are the germs in your home? Well, in this particular study in 2008, very surprisingly, the germs were found everywhere except where we potentially thought they would be. The kitchen chopping board and the child's potty, there was none there, but they were everywhere else in the home. If you see on the bottom right-hand side of the screen these sponge scrubbers, every time my wife's back is turned, I bin these scrubbers. They are a bug stew, a wonderful moist breeding ground for germs, particularly when they're stored in the sink and not let dry out. So use them sparingly. You only use them where necessary, and be sure and disinfect them. And of course, in the follow-up study to this particular one, the highest bacteria found in the wet area where you get particular loads of biofilm growth, but also all the handles. Things to watch out for, of course, are the keyboards, the mouse, the phone, and always the remote control. The remote control seems to be regularly forgotten as an item that should be disinfected, but all the family members tend to touch it. So let's go in to have a look at some of the tips for not bringing home infections. Can you have a separate pair of shoes for work? Maybe even leaving them in the car and so on. If so, it's certainly worth doing, and disinfect the shoes weekly as well. If you have a watch, can you disinfect this particular watch, or don't wear a watch? Pens. I remind you of that study, a study on biofilm in the OR. Even on the little paper clips, a biofilm was growing. So work pens should stay in work. And obviously, you can change out of your scrubs before going home into a safe pair of clothes, or change them out as you enter your home. Your car, don't forget the inside of your car. This can be a transmitter of pathogens, because your kids or your partners or so on can be traveling with you the next day, that day, so on. So you can do a disinfection procedure for your car as well. And as I mentioned earlier, clean and disinfect. And note I said that clean and disinfect the mobile phones before going home. General advice, you all know this, but this is advice you'll be given to your family too. And I include hair in it. So hair, nose, eyes, mouth, this is a T-zone. We just got to keep training ourselves not to touch it. We have to improve our home disinfection and not sanitization. So sanitization does not kill sufficient pathogens to make a surface safe for healthy people. We need to improve the disinfection of it, and you can only do that with some EPA-approved disinfectant. And then have regular checkups to see if you have a particular pathogen you might be carrying inadvertently. Before returning home, we mentioned changing your clothes, washing your hands to your elbows. If you wear civvies to work, avoid long sleeves if possible. And finally, for those traveling home, not everybody's going in cars. Some people will be on trains and you name it. I say go with the mask. I know there's opinion is divided on it, but a disposable mask, if you can, I would wear it. Okay, so on arrival home, take off your shoes and leave them at the door. Leave your clothes in a tied plastic bag or straight into the laundry. Always with anything related to where you work. You don't scrunch down the bag and end up getting a plume of air from the bag into your face. You gooseneck swing it and tie it so that you don't pull pathogens into your face. If you've done some shopping, consider leaving everything except the perishables at the door in case there are some virus on it from the actual shop itself. When you're washing your hands, apart from what you will do at the front door, always, and this is important for your family members too, always wash your hands in the bathroom, never in the kitchen sink. If you wash your hands in the kitchen sink, what you're doing is populating the biofilm that grows in the drain itself with new pathogens from the hospital. You certainly don't want to do that. So the bathroom is where we wash our hands. When you arrive home, shower if possible, and then disinfect the shower floor. The shower floor does accumulate quite a lot of pathogens. If you have a mat outside your shower, seriously consider getting rid of that mat. They are they're a home for pathogens, and use just a launderable towel instead of a mat. With your family members, when you arrive home, obviously you can do a quick observation to see that none of them have any symptoms. And as ever, when we arrive home, folks, toilet paper is very porous, so always double it over and then proper hand hygiene afterwards. Thanks a lot to Josh Merson here for this photograph. This is a current procedure that he's doing himself. He has an 18-month-old son who has asthma. So Josh, when he arrives home, goes through a full procedure of taking off everything. And then on entering the home, and here's a really great idea for you, have set up a little front door or back door or garage disinfection station. This means that you don't have to wander through your home looking for where did I leave the hand disinfectant, where did I leave the shoe disinfectant, where should I put my clothes. Everything is ready. And this is a great reminder for your family members as well, that when they come in, wow, okay, I'll just go through this and we've done a good job. So within this system here, there's alcohol to disinfect phones, there's hand sanitizers, there's paper towels to wipe things down, there's a garbage bin to get rid of the little towels, and if you don't do this, well, you can spread pathogens throughout the house on your way to do proper disinfection. So if you have a garage, you can undress in the garage and ideally, as I said, go through a full shower. And you all know how to wash your hands properly. For our family within the home, educate your family members. Educate them to self-protection and to the prevention. Educate them to the symptoms alert. Educate them to proper hand washing. Educate them to the don't touch the T-zone and simple things as we learn, like your toothbrush. When you use a toothbrush that is infected, you're effectively, the little bristles on the toothbrush are injecting directly under your gums and perhaps into your bloodstream pathogens that are on that brush. So let the toothbrushes dry out and keep them well away from other toothbrushes and well away from your toilet. And then encourage your family members to have regular checkups. Some other thoughts for you folks. I've stopped wearing false nails myself, but please don't wear false nails. They to work, I mean. They really can accumulate, and it's been proven that they accumulate substantial amounts of pathogens. If you are ill, stay at home. You have become one of the vulnerable. So please stay at home and mind yourself. And if family members feel unwell, we have to listen these days. As healthcare workers, we can be a bit jaundiced about man flu or things like this. But if there is any complaint being made, let's listen a little more tightly these days. So, disinfection home procedure. Biofilms are in the home just as they're in the ICU as per that study. So you need to use a disinfectant, EPA approved, that kills these. Ideally, you should use a high-level broad-spectrum disinfectant. What I mean by broad-spectrum is that it kills bacteria, microbacteria, fungi, spores, viruses, and biofilm. If your disinfectant doesn't kill all these things, then what's left behind survives, multiplies, and mutates. So you're looking for something that can help kill all of these things. If you use cloths in your kitchen and you wash them, then maybe give them a microwave after the washing process to really kill any of the pathogens on them. Never store these cloths beside the sink, because biofilms grow at about an inch per day from the drain holes in the sink. Therefore, drain hole disinfection is also a good idea. So before you go to bed, because this will mean the disinfectant will dwell overnight, you can put in a circular motion, you can put a disinfectant that's effective against biofilm down the drain. Coronavirus, obviously, the studies are showing, can survive for up to 72 hours. So this is why you want to use a disinfectant regularly. We talked about the clothes washer, how these low temperature washes can result in a breeding ground for pathogens and have been swapped between clothes. So ideally run a boil wash every week and then let some disinfectant dwell in the sump. For soft furnishings, this is a tough one, folks. Steam seems to be the best way to disinfect those, and I've currently nothing better to offer you than that. And as I said, disinfect your sinks at least every week. Now let's just look at where the frequent touch surface. So we don't all have all the time in the world to disinfect everything in the home. Forget about it. We're not going to be able to do it. We don't have the time to do it. So what are the things in particular that we should consider? So our car itself and our car keys, the doorknobs, the table surfaces. These are the things that are, now it's not an exhaustive list, I'm sure you can add to it, but these are the things that are most frequently touched in your home. The backs of your dining chairs, the kitchen counters, the handles of the coffee machine, the kettle, the fridge door, the microwave door handle, light switches. I mentioned already the TV remote control, then things, game controllers and laptops, and the mice. Never forget the mice. Toys, bathroom tops, bathroom counters, the faucet and faucet knobs, the shower door. If you have a shower curtain, the technique to disinfect the shower curtain is to put a disinfectant cloth in both hands, disposable paper, and run it hand to hand like a silent clap down along the side of the leading edge of the curtain itself. For your toilets, folks, we all obsess about disinfecting the seat when it's the handle that's the most infected item. So more so than the seat itself, disinfect the handle. And then empty out your trash on a daily basis. It can be a breeding ground, so get it out of the house much more regularly than we normally did. And again, if you're pulling out a bag of trash, be careful that you don't end up with a plume of air coming up into your face. You want to do a gooseneck twirl of it, and then you can tie a knot in it. And as ever, after you've finished cleaning, you've got to clean yourself, clean and disinfect yourself. Some other small tips: don't use the same cloth in the kitchen and the bathroom, and disinfect a mop after use and let it dry out completely. You mop from the floor into the bucket. So some people think they're doing a good job if they use all of the liquid contents from the bucket. Be careful that at least 50% of the liquid contents should remain in the bucket, because if you use it all you've done is lifted the dirt from the floor and then put it back on the floor. Next point, ladies, you were right all along. We should keep the toilet seat down, because every time a toilet is flushed, there is a 6-foot plume, airy plume of pathogens that rises from the toilet. And this is what's getting onto the toothbrush. So for your toothbrush, you can let them dry out, as I mentioned earlier, and keep them far away from the toilets. Cell phone disinfection, we said we'd get her. So use maybe some waterproof or water-resistant case, something non-porous, and perhaps like a Ziploc bag that you can dispose of, so that you can do proper disinfection of it. The disposable bag is quite a good idea. Clean and then disinfect the device, because there's lots of oil from our hands and other organic matter on it, and you can't properly disinfect something if it's not cleaned properly. And then a really good idea is set yourself a little alarm, perhaps just before you leave your place of work, to remind you to carry out that disinfection procedure, because you know you're going to be putting it beside your mouth within minutes of leaving your facility. Here is a request for you folks. Our friends in the environmental services, there's a big turnover of staff there, so please apply to your infection control committee very regular training of these EVS people to help them protect their staff, their family members, and that's something I'd love if you could take on to encourage. Okay, so folks, you're burning the candle at both ends. You're absolutely amazing and amazing at this time, but you're not magic, and we really need you to stay healthy. So please do. Thank you, and with much love from everybody at Kersia. And remember, you know, there is light, there really is light at the end of this corona tunnel. And right now, for many, many people, you are that light. Stay safe. Thank you.
Well, thank you, Michael, for that excellent and very informative presentation. We have several questions, so let's get started. Our first one, I'll go back to my screen where I can see it, mentioned a study that was published last Friday by the CDC, which showed the shoe soles of the healthcare workers in the hospital had 50% positive rate of COVID infection on them, and furthermore swabbed the floors in the pharmacy in that hospital, which is restricted, of course, no patients go there, and the pharmacy had 100% positive rates of COVID-19. So the question is, what is your suggesting on stopping the spread of shoeborne pathogens in the hospital, as well as advice to healthcare workers for the shoeborne pathogens they may be bringing home from the hospital?
Okay, well, it's a critical area, and you know, I feel humble because I through lack of knowledge, misled people for 17 years. I did not realize or understand the importance of floors. So, and it's a new learning, and thanks to Professor Donsky on it. Now that we know, we need to disinfect hospital floors. Now that we know, you please apply to your infection control committee to consider either some form of foot dip with a dry process afterwards, or some kind of wet walkthrough, moist disinfectant cloth walkthrough. This is the only way we're going to get on top of this, is disinfecting the floors, so no longer detergent cleaning. Most hospitals that I know of had been just using a detergent cleaning for the floor. We need to move to a disinfectant for the floor. It doesn't have to be the high ppms used in the critical care areas, but it needs to certainly be effective against a broad spectrum of pathogens. So I'd maintain the quaternary pneumonia compounds, QUATS, is no longer enough. You need a disinfectant EPA approved to kill all of the emerging pathogens and a broader range.
I think it's interesting that you were talking about the effect of the droplets on the floor. I think we have focused so much on the airborne and N95s, we have forgotten that aspect of the droplet impact. You know, that's very interesting. Our next question is from a former presenter, Dr. Rode. Said, great presentation. How would you encourage building the culture of cleaning or disinfection in the public without the germaphobe mentality?
Wow. Well, you know, here's an interesting thing, folks. We know generally in the world what the germs are. We know generally in the world the chemicals that will kill those germs. So we have the problem and we have the solution. The difficulty definitely lies in the middle, and that middle is the behavioral change. So obviously, for the broad population that was mentioned in the question, we need broad campaigns of knowledge and education. This is the time to do it. We will never get a time again like this to do it. So now is the time. And then each one of us on the call here we have responsibility within our family to educate them. But it never works when we try to insist and push. We want them to be part of the change. We want your family members to really feel part of it. So it's a family-wide issue, but we need to bring them along as hey, how do we all mind ourselves from this, as opposed to mom or dad is insisting I do this, or my partner is insisting I do this. No, behavioural change only works with the consent and the excitement of the person you're trying to influence.
Michael, I really appreciate that part of your presentation. When I did my dissertation, I used the health belief model for my framework, and that's what I'm hearing you say. Human behavior is such a complicated concept, and I really appreciate that you're bringing all those factors into it. Our next question was, do you feel that over-disinfecting can increase opportunity for opportunistic bacteria and viruses? Natural flora helps combat some bacteria and viruses. And this person said the slide you provided showing the Japan model and topical etymology was a perfect example.
Yeah, okay, so I don't want to stray too far outside my area of expertise here, and I have a molecular microbiologist PhD sitting not too far away from me at the moment, so I don't want to trample on their ground. There is in life, of course, there is such a thing as too much, and we see it in Japan. Interestingly, there are studies that show that families with pets, dogs in particular, that the children have less diseases and are more robust than families without. So there is certainly a thing called there is certainly too much that we can go to. We are at this moment in a dangerous situation. So at this moment, it's difficult to err on the side of too little. So I would be increasing that spectrum. And as I was pointing out in that slide, you can move yourself up and down along the spectrum depending on whether you're nursing people who are at increased risk, or whether you have family members who are increased vulnerability. So your questioner is correct. There is such a thing as too much, for sure, but we are in a heightened state at this time.
Okay. Here's a question. I'm going to give my thoughts and I'm going to shoot it over to you because I don't know if you'll, let's just hear it. The hospital I work at, some workers wear shoe covers in the OR department. How often and when should they change the shoe covers? So I would say that the shoe cover, if you're wearing it from room to room, you're protecting your shoes and not the surfaces. So I would say change it every time you enter a new area that you're trying to protect. What are your thoughts on that, Michael?
Oh, I couldn't agree more. You know, I call it the gloves fallacy, that for a lot of people, they consider that when they've put on a pair of gloves that they are more protected, but they can equally be putting the glove to their T-zone or wearing it to multiple different places and not performing enough hand hygiene and changing out the gloves. So absolutely, you need to segregate where you are, and if you have worn something into a risk area, or if you're going from zone to zone, you need to be changing it. And it certainly comes from, we've heard now 3 studies today, that new one I hadn't heard from the CDC, the one from Wuhan and the previous one, that floors are dangerous. So they're a heightened risk.
I had just gotten that question from graduates of mine who are now working and about shoes, and they were trying to find products to clean their shoes, but of course the stores are out of everything right now. I was going to comment, I really appreciated your algorithm about should the family member be at home. So I shared with you before the webinar started that I'm a nurse and I'm just recently returned to the hospital to help them. My husband's a hospital pharmacist, and our son with asthma, who's a senior in college, he's not a young child, lives with us. And we actually asked him if he was comfortable staying in the house with us since we could be bringing it home, and gave him the opportunity to go stay somewhere else if he felt at high risk here. I know before the webinar started, we also discussed a little bit about scrub etiquette, and you know, not wearing your scrubs out in public if you leave the hospital and then run by Kroger or the grocery store on your way home, that you could possibly be taking pathogens out into the environment. Do you have any comments further on that?
Yeah, I mean, if there are scrubs, if they're your own scrubs and you need to bring them home, I would certainly be considering putting them into a tied plastic bag and bringing them home, because we saw 31% of all scrubs examined had pathogens on them. So they are a risk item. And who knows, you know, amongst the public now, there are some who will appreciate and applaud you as a frontline worker in your scrubs, but there are others who will be somewhat threatened by the fact that the scrubs could have pathogens on them. So I would recommend that you don't wear them publicly if possible.
Yeah, we're certainly seeing that here with nurses either being hailed as heroes and people applauding them. And then in Europe, there was a nurse who was actually evicted from her apartment because they felt like she was potentially exposing everybody in the apartment complex. So Wow. It's kind of interesting. I did have one point of clarification, so I'm sorry. You were talking about taking a shower and not using a mash. Are you talking about like a loofah, the little porous thing you get with shower gel? Is that what a mash is? No,
what I meant is as you step out of the shower, people often have these lovely colourful mat and to absorb water from the body just outside the shower. And these mats, these shower mats, have been studied and are found to be really replete with pathogens. So what we need is something that is being replaced very regularly and laundered properly. So these mats are dangerous in the hospital and at home, and should be considered a risk item.
Okay. Here's a question that says, how long can the virus stay on our scrubs? She's thinking we should keep it in a bag and leave it there until the virus dies. And then would you be bringing it in to wash, lessen the risk of transmission? So is that viable? So I think the question is, I know some people here, let me just see if this is what she's asking, like that if you left the clothes in a paper bag for 3 days, could the virus potentially die before you wash it? I think that's the question.
Yeah. So the studies on the particular virus are increasing all the time. Initially, we thought it died much more quickly. And if died is even the right word, but people will understand what I mean. So if you have the luxury of having a number of different scrubs or clothes that you can rotate, then certainly by all means, as long as the bag isn't going to be interfered with by children or there aren't holes in the bag, you could consider leaving it for a longer time, because it certainly will assist you, and then you won't transfer the pathogen to your washing machine.
Okay. I was going to ask, you mentioned leaving non-perishable groceries for 24 hours if possible, but where did the number 24 come from? Why not 3 days if possible? What was your thought on 24 hours?
Yeah, it's just an arbitrary figure. We don't actually have any study that we could currently find other than what we're finding on surface items like plastics and on surface items like stainless steel. So at this moment in time, our best estimation of the mix, the basket of different items in it, we found that 24 hours was reasonably sufficient for a reduction in the pathogen. But we're open to correction on that, I have to say. It could be longer, could be better in this instance.
Okay. What about bringing food home from the grocery store? Like, should we be washing it, cleaning it, like using baking soda? What are your thoughts on that?
Yeah, I mean, I'm happy to see that most stores now have improved their sanitation methods. They're wrapping items in cling film, but before it was wrapped, it might have been affected. So look, we're in this situation right now. So the more infection control procedures you run, the better.
Okay. I also really appreciate it.
Yeah.
Go ahead.
No, I was just going to say, with the caution, folks, that we have to live, and at the end of the day, we can't exhaust ourselves with this. So the important thing is that you're healthy and that your mind is in a good place and that you're able to go to work refreshed the next day. So our home is our castle and it shouldn't be a threat to us. So everything I say, I'm saying we need to do this in a gentle way, in a way that doesn't cause the home to be anything that we're threatened with. So do it in such a way that is comfortable to you, but not more than that, because we need our rest.
That's very good words of wisdom. I was just going to say, I really appreciated your list, although you said it wasn't exhaustive, of things to clean at home. So we know that it's typically the high touch surfaces. Would you also, how would you recommend us cleaning our floors at home, since we know the floors in the hospital? Like, what products are available to us in the public for cleaning at home?
Well, perhaps you can apply to your facility if they might spare you some disinfectant. Who knows? It might be worth talking to your facility about it. But look, there's quite a range of EPA-approved disinfectants. So you want something that's not just a sanitizer. So when you see kills 99.9% of bacteria, be suspicious, because that's not enough really for disinfection, and it doesn't mention viruses and doesn't mention other things. So I'm deliberately sort of giving you a general answer to this, because there are quite a number of options that you can do. That's for all hard surfaces, all soft plastics, glass, countertops, etc., etc. And for your wet areas, you do need to be using something that's effective against biofilm. However, as I mentioned, for your soft surfaces, your carpets inside your door, perhaps if you have a soft couch, it seems to me so far that steam cleaning is very effective.
Okay, I was going to ask you another question. As far as cleaning our showers, I had not really thought about cleaning the floor of the shower. Would chlorine be a good option for that?
Yes, indeed. It's certainly one of the best options. And you can let the chlorine dwell in the drain. Ideally, even let it dwell overnight to prevent any biofilm growth down there. So the floors of showers are a risk area. There's high levels of pathogens on those floors. So they do need to be disinfected. And remember, you're walking very often from your shower and maybe getting into bed shortly afterwards. So this is how you can transfer germs that were somewhere on your body onto the shower floor, onto your feet, and then into your bed. So yes, I would certainly disinfect floors, and chlorine is a good broad spectrum disinfectant.
Oh, wow, that's an excellent point. I hadn't thought of that. I was going to point out, you mentioned using moisturizer for our hands to prevent the dermatitis, which is excellent. But I was just going to caution anybody listening to make sure that your moisturizer is compatible with the gloves that your facility uses, that not all moisturizers are compatible with all cleaning, the soaps and the gloves that we use. So just make sure you run that through your infection prevention team at the hospital as well. Michael, most of the questions are actually people just saying what an excellent job you did and how much they appreciate it. So it's interesting. We're not getting as many questions as appreciation and comments of how excellent this is, and that everybody, not just healthcare workers, should watch this. Somebody said the people in the grocery stores need to watch it. So are you seeing that in Ireland as well? We're seeing the public is using PPE here, but they're using it so incorrectly. Like they either have their mask under their chin or just, with their nose exposed, or they're wearing gloves and just never changing them and touching everything with their gloves.
Yes, there's a lot of error in innocence going on. You see people driving their cars with gloves and traveling around with it. Not so many masks being used in Ireland. I'm literally just traveling from work to home and back again. I'm not going anywhere else. And our next step, if things get worse, is we're going into a lock-in as opposed to a lockout. So from where we work, we'll be locking ourselves in here and only leaving on a weekly basis. So it really depends on what sort of spike we see.
Oh, wow. Yeah, we're preparing for a surge here. So I mentioned I went back to work, and we're creating a 200-bed hospital in a parking deck, getting ready for the surge they're predicting. Dr. Rode wrote a very good comment, and this is very true. He's just reminding people to be careful not to mix your cleaners in the shower, which is a closed area, because of the dangerous gases which could emerge. And it's interesting.
Very good point.
Dr. Rode, because I just read where people were saying quit telling people to disinfect their mask in the microwave, and that there's been some house fires because people forget there's a little piece of metal in the mask, and they're microwaving their mask. So I think we do need to remind people of fundamental safety as well. Well, I think we've answered most all the questions. And again, if we didn't get to your question today, remember, we will answer them and get back to you with a question there. So let's just thank Michael again for this excellent and just such a kind presentation. I think we all appreciate just your kind words of encouragement today. So thank everyone for attending today. Remember, join us Tuesday, April 21st at noon Eastern Time for best practices to service facilities for COVID-19. I hope to see everyone there. And Michael, did you have any closing words?
No, everybody stay safe. You are magic. You are amazing, but you're not magic, so be careful. All the best.
Thank you so much. Thank you, everyone. Bye-bye.
Bye-bye.
You want me to run and go get